So, how worried should you be about the measles after this big outbreak in Texas? I'm Ellen with PolitiFact, a nonprofit fact checking newsroom. We've been seeing a lot of online misinformation about the outbreak's causes and the measles vaccine safety. So, our reporters talked to experts about this outbreak and how to keep you and your family safe. Measles is an infectious disease caused by the measles virus, which is airborne. It usually causes a fever, rash, a runny nose, and red, watery eyes. In severe cases, it can cause pneumonia, ear infections, and swelling in the brain. Measles is contagious, like really contagious. The Centers for Disease Control and Prevention says that 9 out of 10 unvaccinated people will become infected if they're exposed to measles. And nearly 1 to 3 of every 1,000 children with measles will die, usually from respiratory or neurological complications. The good news is that the measles vaccine, also called the MMR vaccine, is really effective. 2 doses of the MMR vaccine are 97% effective against measles. The CDC recommends kids get their first dose around 12 months and their second dose around 4 years old. Because of widespread vaccination, measles was declared eliminated from the US in 2000. Meaning it was not regularly spreading. But public health experts said the frequency of measles outbreaks in the US has been growing since 2000. As of March 13th, the CDC reported there were 301 cases of measles across the US. 259 of those cases are in Texas. 34 people have been hospitalized, and 1 child has died. PolitiFact has seen online posts try to link the outbreak to people migrating to the US through the southern border. International travel can contribute to measles spread. The Texas health officials said they don't have information linking the West Texas infections to migrants. A Texas Department of State Health Services spokesperson told PolitiFact that the first cases were in residents who hadn't traveled internationally. It's also worth noting that Gaines County, the rural county at the center of this outbreak, had one of the state's highest vaccine exemption rates. More than 17% of the district's students cited a conscientious exemption to 1 or more vaccines. Because measles is so contagious, experts say that at least 95% of a community needs to be vaccinated in order to prevent spread. We've also seen claims that the outbreak in Gaines County was caused by a measles vaccination campaign. But vaccines don't increase the spread of measles. They curb it. These kinds of claims often stem from a misunderstanding of something called vaccine shedding.
So the measles, mumps, and rubella vaccine, it's widely considered a very safe and a very effective vaccine. It's a 2-dose attenuated live virus vaccine. And what that basically means is it contains a weakened form of the virus that causes a harmless infection in the body. The immune system responds to that infection, and then the body develops immunity. That weakened virus can be shed in a person's urine or stool, but that cannot be transmitted to another person and cause measles in another person. It's too weak to be transmissible like that or contagious like that. And it certainly cannot cause measles outbreaks.
So, do you need to be worried about the measles? If you got the measles vaccine as a kid or had the measles previously, you're probably okay. If you got your measles vaccine in the 1960s, you may need to get revaccinated. That's because from 1963 to 1967, the MMR vaccine was inactivated, which means it used a dead version of the measles virus. But the inactivated measles vaccine wasn't as effective. The CDC recommends 1 dose of the live vaccine if you got an inactivated vaccine previously. The main populations of people at risk from measles are kids under 5 and immunocompromised people. If you're concerned about measles, make sure to talk to your doctor about how to protect yourself or your family. What questions do you have about measles or the MMR vaccine? Let us know in the comments.